Barry, and this is
Gary.
And today, I don't know what our names are. Today, we are going to be reviewing microcurrent, which is a form of electrical stimulation. And yes, as Gary said, this is microcurrent electrical stimulation, which is also abbreviated as MES. So, what this is it's a subsensory form of electrical stimulation, and which just means that it's under 1 milliamp or under 1,000 microamps, and that's going to be your amplitude, which we'll get to later. The reason we do microcurrent is for this patient, he has a left wrist injury, and that's causing him to not be able to sign his signature. So what we want to do today is limit some of the pain and inflammation he's having in his wrist. So how microcurrent does this is it is able to sort of reset the electrical charge within his joint there at a cellular level. So it'll kind of bring his electrical charge back to a homeostatic level. And because he has so much inflammation and pain, we're going to be using a negative polarity, which is, according to the research from your textbook, is what we use in the case of inflammation or acute injuries. So, before we get started, what you'll do is you'll assess the skin for any open wounds or any redness or anything that would maybe make you stop and say, let's not go through the treatment today, but everything looks good there. I will eventually clean the skin too before I put the pads on. Before I do that, I will go through with the alcohol. Before that though, I will go through a few contraindications. Our diathermy device is off, which is good. He's a male, so he's not pregnant, and we're not over the fetus anyway. Do you have a history of cancer in the area? All right. And then do you have an indwelling electrical device or a pacemaker, anything like that? Okay. We're not over the carotid sinus, and we're not over the head of neck in case they have a history of seizures. One other thing that you can maybe ask is if they've ever had a allergic reaction to self-adhesive stuff, because we are using the pads. So have you had that? All right, good. So we're pretty much good to go there. And our objective measurement here is he's not able to grip a pen and sign his name. And since that does cause pain, we're not going to have him try today. But eventually, after a few treatments with this, we'll see if he can do it. And in theory, he should be able to grip the pencil and sign his name when he has less pain and inflammation. So, to get set up here, I will first clean the skin. So, skin clean. Good. Yep, with good body pants, of course. Okay. So, take it, wipe it. Now it's all clean, beautiful. All right. I'm going to move this a little bit closer to the patient, just so that he's not reaching super far away. And let's get these. I'll do that after. So to turn on the device, there's a little button behind, and you click it, and it turns on. So sometimes it takes a little bit of time to calibrate. So to choose microcurrent, you find micro, you hit micro. Right now it's on a negative polarity. As we are further along with the treatment and we want to sort of build up the tissue in the area, we can use a positive polarity. To get to that, you hold this pause function and then hit that, and now it goes to positive. You can also do an alternating current, because this is a biphasic version of microcurrent here. But like I said, today we're going to be just using a negative polarity because of the pain and inflammation he is experiencing. This is your microamps, so right now it's at 450. What we'll do here is we will put the pads on his skin. If he feels anything, we will just back it off. But basically you want to go right up to where they feel that sensory stimulus, and then a little bit down from there, because it is a subsensory form of treatment. For this frequency, for pain control, you want to use 30 hertz. So this might take a while, but so this is hertz here. 30 hertz ish. 30. Okay. So from here, what I will do is I will get the pads connected, and then we will apply it to his skin, and he's feeling it basically along this portion of his wrist. So we're going to apply the pads here over that painful area. Oh, now it's just the time. And for treatment time, depending on the research you look at, it can be anywhere from 30 to 45 minutes. So today we're going to be using 30 minutes to see how efficient this form of treatment can be for him. So you'll apply the pads on the painful area. Luckily, my patient has a good posture, so I don't need to badger him about that. So we'll jack this up to 30 minutes. 30 minutes, all right? And then we would hit start.
And then they'll push on the, they'll have...
Yeah,
So,
and then I have to...
are you feeling anything at that? Okay.
They'll have
So
me
we'll
put the leg
put it
back
up a
and
little
then I'll
bit.
have to kick them out, and then they'll have to like this snap like that.
Are you feeling anything there?
Just so that we can tell how much resistance and stuff like that, I want to do the pull.
How about now?
Is that okay with you?
Yeah, I'm just trying to,
No,
you know.
no, I'm...
So he's feeling it at
I'm
that
taking it in.
intensity, so we're going to drop it down a little bit.
Last night because I have an appointment with my neurologist.
Are you feeling anything now?
Nope.
Okay. So this is where we'll keep it at for 30 minutes.
Testing that.
Yeah.
And this is that subsensory, so we don't want him to feel anything. So provide
But I mean, if that's not.
patient with a call bell in case we have to leave for any reason. But I won't be going anywhere. That is Microcurrent. So 30 minutes is up. We'll stop it.
If you want you to see like somebody else pulling, if it pulls out,
Pads on
instead of
here.
pulling in front of you. Thanks for working so hard today. That was awesome. Nice meeting you.
Relax the arm a little bit. And then, depending on the circumstance, if he wasn't in a lot of pain to start the treatment, we maybe wouldn't have him try to sign his name right away. But a little bit further down the road, we could say, are you able to sign your name now?
I can get the door.
Probably not the best clink to do. Just
Can.
And look at that, he can. So
there's bars everywhere.
that is microcurrent,
Kind of a...
another form of electrical stimulation using pads.
Thank you.
Cut.
Afternoon. I'm Barry.
And I'm Gary.
Now we are moving on to probe.
Asymmetrical
Probes.
buttons that go
So we are doing MES again, which is microcurrent electrostimulation. So with these, you attach these, you put Q-tips on them, wet them so that they conduct,
And then he said,
and so that when you're using the area, or when you're utilizing it, you can post there and it'll conduct better. First things first, it's the same philosophy. The microcurrent is a subsensory level. It should, what it should be doing is healing the tissue. Safe. It's under 1 microamp. So, first thing, he'll ask the contraindications. Same thing, the diathermy machine's not on. The he's not a female, so there's no fetus. Same with the carotid area. It's not over the cancer or the head if the patient has seizures. So, how's it going?
Good, how are you?
Okay. So, with this, since we're going to be treating today lateral epicondylitis, which is inflammation of it from playing tennis. So he hasn't been able to play tennis as of lately. And he can only hit, how many? You can only hit 4? 5. So what we're going to be able to do is we're hoping that he can get through a full tennis practice, which has at least 40 to some hits. So he's going to, his goal, his objective measurement is to be able to get an entire tennis practice. So first I'm going to check out the area, make sure everything's good, that there's no, there's no fracture in the area. That's another contraindication. I'm going to palpate and see where that area actually is. So I can feel that this tendon right here is because this ligament is very inflamed, sticking up. So we're going to move to, we're going to be moving to the hertz. We're going to be using 0.3 hertz on this. We're going to be using, once again, up below 1 microamp. So we're going to start around 450. With this, there's a probe on the probe. You can actually turn it on and increase it and decrease it with these buttons. So we're going to start, there's 2 patterns that we can use, either the ladder, you go up and down the wound, or say if there's an open wound in a circle, you can do the clock, and you can actually keep going. You want to stay at each position around 5 to 15 seconds, or 5 to 30 seconds, depending on the location. Since we're going right here, we're going to do about 5 seconds, just to speed this up a little bit. So I have all the parameters set, everything is hooked up, everything works. The Q-tips have been wetted. You can tell if they're working by the conductance on this top right. When you put them together, they should go up. If you're not having any conductance, that means that the treatment won't be working. Any other, also thrombolytis, make sure that's another contraindication. Am I missing anything?
I don't think so. I think you're good, Barry.
Alright, so now we're going to start. You can either start at proximal or distal. We're going to start distal. We're going to go across the area. We're going to hit this treatment on. You can hear the beep that goes on. We sit there for 5 seconds. And I'm going to turn it off. Move up the treatment area for 5 more seconds.
There's also a plus or minus on the probe here, so if I was feeling any sensory stimulus from this, since this is microcurrent, we want to have it be subsensory, so if I was feeling anything, which I'm not, he could hit that minus button and it would do that same thing with the intensity, just drop it down a little bit.
Yes, should have asked him also if feeling anything. Alright, and we're going to go down, do the ladder formation.
And depending on the size, if it's a larger area, it'll take a little bit longer, but because this isn't that big of a tendon or anything, it's not going to be as long of a treatment, which is nice because then we have time to do other things throughout the treatment.
Yes, so that concludes the treatment session. So hopefully next time that you go do your backhand, you get a full segment in. So we'll document that, make sure that we have these the parameters set, and that next time, hopefully, the tissues will be healed. And next time you'll be able to come back in and we can do another treatment.
Full practice.
Is there anything you'd like to add?
This video was sponsored by
Lake Superior College
and
Physical Therapy Assistant Program.
And
The
Brenda
best
Barton,
place to start.
and Aaron Hawley, and thanks to Linda Farrell, and Jane Worley, and thanks to Stacy for being our camera person.
Stacy Larva.
Stacy. Really? Caterpillar.
LeVar.